Hi guys, this is episode 6 and the letter F, and we're going to begin by talking about flattening the curve. So what is flattening the curve? It's two things. One, ensuring that hospitals aren't overrun by symptomatic or severe cases of COVID, and two, ensuring that the number of cases remains below the capacity of the healthcare system. So that's basically what flattening the curve is. We've heard all about it over the last sort of 2 months or so to make sure that not enough people get, enough people aren't infected to overrun the systems. So there's two other concerns. One, flattening the curve helps in protecting healthcare professionals, people that are on the front lines of this viral disease. If they are sick, you have a problem. If the healthcare professional does not have to worry about his sickness, his illness, then he can fight the disease. An increase in the number of cases just predisposes them to the virus more, and they're more likely to fall ill. Second thing, the other thing with flattening the curve is that the healthcare professional doesn't have to make a difficult decision on who gets to live or die. That's the other thing that you want to avoid completely. So flattening the curve will help in that. Now, concerns with flattening the curve. There was a study in Australia that said that basically flattening the curve will not help in curing the people of the virus, because once you reopen, they'll get it anyway, because it doesn't allow herd immunity to develop. Now, herd immunity is when 60% of the population gets the disease and has some form of immunity to it. Then there were two other studies, both out of the US. The first one said that flattening the curve was obviously successful in reducing the mortality rate. And the second one suggested that probiotics are actually successful in helping flatten the curve because they reduce the number of symptomatic patients. Now, again, I am not too sure about this because both the researchers were on panels for probiotic companies, so you can believe what you want out of that one. But basically the concept is that flattening the curve will help reduce the load on the healthcare system, keep healthcare professionals safe, and also basically allow people to remain fit. Essentially, that's the idea. Moving on from that to fitness, that's something that has been spoken about a lot during the lockdown. How do you stay fit at home? Gyms have been closed. You can't go out to the park in most countries. Lockdowns are strictly enforced. It's a bit risky. So people have decided that they're going to work out at home. Now, in most cases, all you need is a yoga mat and a mobile phone. A lot of people on Instagram have decided to make fitness videos, and it's a great thing. It's a lot of innovation, a lot of people giving you home workouts, and giving you little taps on the back the minute it's done and things like that. You do your workout and you get to stay fit at home. What the funny bit is, it's also led to a few sort of ridiculous challenges. Namely, this one. This is a handstand fitness challenge from slightly earlier on in April, and check it out. Why you would want to put on a t-shirt while doing a handstand, beyond me, but dude, he can do it. So I mean, I guess no, I cannot do it. Trying really hard though. Anyway, moving on from fitness to somebody who's remained in the eye of the storm, Dr. Anthony Fauci. Who is Dr. Anthony Fauci? Why is he interesting? Two main reasons. Number one, who is he? He is the director of the National Institute of Allergies and Infectious Diseases. He's a former AIDS researcher, but he's also on Donald Trump's coronavirus task force. Now, he's given a number of interviews over the last couple of months. The interesting bit here is that him and Trump do not see eye to eye. He's openly critical about Donald Trump's idea of reopening the United States. He believes that they have not controlled the disease in any way, shape, or form at this point. He also was critical of him reopening schools, claiming that is very, very dangerous. The other reason that I'm more interested in him is because it has links to a company called Gilead Pharma. Gilead Pharma is one of the companies producing a drug called remdesivir. Now, they ran a trial in the United States, and they said it was a cross-country trial on the efficacy of remdesivir. And Dr. Fauci and Gilead Pharma, their trial found positive results. And he comes online and publicly states that the data is positive. But I read a study from the Lancet journal. It was a Chinese study. And they found completely polar opposite results. Now, their study was published just a few days before Dr. Fauci's and Gilead Pharma's. They found completely polar opposite results. So, is Dr. Fauci espousing remdesivir because he's getting an alleged kickback from Gilead Pharma? Or are the Chinese researchers wrong? I don't know. You guys can figure that one out.